Hi, we're here with Dr. Jeff Hatcher, the medical director and a large investor in OneCare. Jeff, we were just interested in what OneCare means to you and your physician practice.
Well, I think we're really moving into an area rapidly where remote monitoring is a must and a necessity. Telehealth is going to rapidly expand, especially at the times of COVID and coronavirus and how healthcare has changed and the dynamics have changed. And being able to access data in a real-time fashion that is uploaded directly and accessible to me at a desktop when I need to look at it as opposed to on a specific schedule just lends itself to a much more efficient patient visit. If I'm seeing patients through telehealth, I can access their data immediately through the device and on my desktop, and then it allows me to make real-time decisions as opposed to waiting on a download and accessing data that way.
So this new paradigm we're in called distributed connected care, do you think the time is right for this? OneCare's technology is revolutionary and it's finally caught up with demand. But the medical profession has gone through false starts before. What might be different this time around, in your opinion, as it relates to remote mobile monitoring and access to that type of data?
Well, I think what's happening now are patients are starting to see the value of remote monitoring, where before the traditional, office visit, face-to-face visit was what they experienced, and now they're realizing that they can access care directly by a remote transmission and not have to expend themselves the trips or in times where they may not feel as good to expose themselves to other health risks. The other thing it does is it allows us to do the things that we really need to do with a lot of the chronic disease states like congestive heart failure and diabetes, where we can access data and monitor patients continuously so that we compile that data and then trend it and get a much more accurate assessment of their disease state and how they're progressing.
So as a top physician in your practice, you obviously have the opportunity to participate in lots of different ventures and invest financially in a lot of different ventures. Any final thoughts on what made OneCare so compelling to you and attractive to you from an investor point of view, and also as a medical director and someone who's having daily impact on the strategy of OneCare?
I think with our device, the convenience, the ease, and the simplicity of it make it a must-have. Besides the data management of disease states, we also have other features that help in the elderly population, which again, that's our target population, are the elderly and infirmed. And if we can access them in an easy way without making it clumsy and cluttered for them to navigate, it's to everyone's benefit. And I think this device offers that simplicity and ease of use that gives the patients the most value and most bang for the buck, as well as just a device that's functional and useful.